Good morning, everyone. I'm going to talk about the tech revolution in iBanking, innovations in the training for the next decade. About the history and evolution of the iBanking. In early days, iBanking relied on the rudimentary methods for tissue collection, storage, often resulting in limited success rates for transplants. But now, with the significant advancements, such as improved storage solutions, most of us are using the intermediate solution now. Surgical techniques, we are moving towards the increasing availability of the corneal tissues as well. The evolving landscape of iBanking. The field of iBanking, as we all know, is constantly evolving, driven by advancements in technology, regulations, and research as well. And to ensure the continued success of eye donation, evaluation, transplantation, we need to adapt to the robust training programs so that all the eye banking professionals can move with this technology revolution. And through trainings, we need to embrace the technology revolution and prepare our professionals for the next decade of eye banking innovations. They need to move with the time now. iBanking is a dynamic field, and we all know that. In last 10 years, a lot has been changed. And when we are talking about technology and innovations, let me talk about the latest technology innovation which was done. A cornea was transported through the drone. It was a joint project with ICMR, AIMS, and Dr. Shroff Charity Eye Hospital. Within 40 minutes, the cornea was transported and it was transplanted in the hospital. And I just want to highlight it here that there was no professional involved here. You see the technicians who were actually working with the drone technicians to fly the corneas. Now coming back to the training and the development, we all know that the training and development matters for everyone who is sitting here and all the eye bankers, because for the efficient processes, for the quality assurance, for the patient outcomes. And in the context of the tech revolution, the trainings need to equip our professionals to effectively utilize the new technologies and to maintain the quality amidst these evolving practices. And the challenges in developing the training programs are, we all work in diverse background. Everyone who is sitting here will have their own different kind of problems as well when we talk about diverse background. It's a dynamic field with constantly changing due to technological advancements. We have resource constraints as well involving finances, humans, as well as infrastructure. And of course, the cultural context matters a lot. We have to balance the theory and the practice. Sometimes we have to do those immediate changes even after we have read something in the theory. We need to be flexible as well as we have to standardize a lot of things. And we need to look for the long-term sustainability. If we talk about the training methodologies normally used in the ophthalmic practices and healthcare, we talk about the classroom lectures, with workshops and seminars, practical training sessions, on simulation-based learnings, on-the-job trainings, as well as the e-learning modules. In iBanking, we are working on most of it, but we have to focus now with the evolving technology on the simulation-based trainings as well as the e-learning modules. I'll not go into in this, I'll just show you a picture here. So if we talk about technology, we need to go more on the virtual trainings, online workshops, distance learning, and this is not new for the ophthalmic practices. We have to just imbibe this in our iBanking practices now. Now when we talk about the technological advancements in iBanking, we need to focus more on how can we use the technology to help us in the iBanking. So there are some ideas here. We can have some digital donor screening tools. We can have automated tissue processing and storages. Everyone is working on the blockchain right now, Amazon and all those logistic companies. Why can't we use the blockchain for the tissue tracking and the transparency? And also, this is just a dream when we can have an AI-powered corneal evaluation so that we can move towards more automated things. So if we look at the future of the iBank trainings, we can have predictive analysis for the training needs assessment, remote learning and the telemonitoring, AI-powered chatbots for on-demand learning support. So many of the times when we have to ask something, many of the websites have the chatbots, even an Instagram jewelry shop have a chatbot now, but iBankers don't have a chatbot which can easily answer the questions. And we need to have an open source platform for global knowledge sharing. We do a lot of work in duplicating work, basically. Someone is doing something in Indonesia, in Bangladesh, in Nepal, in India. We need to have something where we can share our best practices. So at Shroff Hospital, we have a Jagat Singh iBank Training Academy where we provide the world-class trainings to strengthen the global iBanking. These are some of the training programs which we offer. And we have developed these tools, the assessment tools for the eye recovery technicians and the eye donation counselors. And we have collaborated with the DGFG, which is an iBank in Germany, iBank and Tissue Bank in Germany. And we are working on developing an e-learning platform. Once it is developed, we will be working on making it more open for everyone's use, and to have a training academy which is more international, so that we don't have to work again and again on the same training programs. And just, ma'am, I'll just take 30 seconds of yours. And how can we use AI? This whole video I have prepared for an e-learning module, only using the AI. I haven't done anything myself. It was just a Word document given, and then everything was done by the AI. There is a voice also which is not coming here, but it is a tool which was, a presentation which was made in 5 minutes using the AI. So thank you so much for the patient listening. The key takeaways we have are the role of technology shaping the next decade of iBank training, need for collaborations between iBanks, technology firms, and policymakers, and we need to continue learning as a key to sustaining the advancements. Thank you so much for giving me the opportunity.